Welcome back to Inside Politics. Our guest today, Nashville Congressman Jim Cooper. He is on the front lines with the House today, about to make a vote on the relief bill. We appreciate him joining us today from Washington. Congressman, President Trump kind of poo-pooed this for a long time. Suddenly he says we're at war. He's a wartime president. Are we winning this war?
Well, right now we're not. You know, the U.S. now has more cases of COVID-19 than any other nation on earth. So far, our mortality rate isn't up there with China or Italy, but it's headed in that direction, particularly in New York and Washington State, where the president has already mobilized the National Guard. Some Tennessee guardsmen have been mobilized, and the 101st from Fort Campbell has been sent in part up to New York. So this is serious as a heart attack here. Because it's an invisible disease, a lot of people don't understand it. A lot of people are underestimating it. And for example, young people who are on spring break and were partying all together were probably super spreaders of the disease. So we got to make sure that everyone realizes even little babies can be infected with this and they can spread it to other people. So by being careful and with physical distancing, we can help solve this thing, but we got to take it seriously.
Now, the president is talking now about perhaps by Easter we could possibly be back and the economy open again. He now says maybe he'd like to put together a plan that does it on a regional basis or a state-by-state basis. Do we have enough information to do that kind of thing? Do we even have enough tests out there to know what's safe and what's not safe? We know certainly a lot of areas are hard hit by it, but we don't know if there's not more viruses in other places that don't even show viruses right now because there's been no testing.
You're exactly right, Pat. Tennessee is struggling with testing. We're unable to open the mobile testing centers that have been set up in Nashville for about a week because we simply don't have the tests or the supplies. Some people who've already been tested in Tennessee have had to wait a week or 10 days to even get the result. So that means that a lot of folks should really be viewing themselves as positive, as having the virus and not spreading it. There's probably 10 times more cases of Tennesseans who are infected and who are spreading it than who realize it. And until we get real testing, we won't know. So I think the president's comments are largely wishful thinking at this point. I would hope and pray that we'd be done with this by Easter, but that's unrealistic. I think a proven disease expert like Dr. Anthony Fauci is a much more reliable voice at a time like this.
What about a vaccine? What about these experimental drugs? Some drugs are already approved, some that are experimental treatments out there. Are those all wishful thinking too, at least for anything that's going to happen in the next month or so?
Well, they're working hard on that, and they're working 24/7. We do know that there are some other forms of coronavirus are susceptible to treatment. But remember, this strain of virus is completely new to humanity. Maybe bats had it, or maybe camels, or pigs had it, but we've never had this before. So it takes a while for our scientists to prove that a cure will be safe and effective.
If we get a vaccine or a treatment, are we going to have to make it mandatory, much like you saw back in the 50s with polio? I mean, right now we don't make people have to take a flu shot every year. We recommend it, but when it's not recommended, are we going to have to make it the law that people have to do that?
I think people have good sense, especially Tennesseans. They don't want their family or loved one to suffer, and they don't want anybody to die unnecessarily. So I think they're going to see enough on TV, so they'll be lining up for this vaccine once it's invented. We just got to make sure it's invented fast.
Has part of the problem been all the confusing and sometimes conflicting information that's come out? I mean, first you said this wasn't a big deal for young people, then now we find out it really is a big deal. They can be particularly carriers of this. They've been scolded now by national, state, and local leaders for doing more. We also have this situation where, in terms of the social distancing, we were told groups of no more than 50, then it went to 25, and then it went to 10, all in the space of 2 or 3 days. A lot of information out there, and people are not quite sure where to trust, particularly since the social media has its own versions of all this.
Well, unquestionably, there are a lot of different voices, and we thrive on dissent in America. But I think the sound public health advice has always been to take this disease seriously and to physically distance ourselves so that we don't spread it around. I'm proud of the mayor of Nashville, my brother John Cooper, for going ahead and having this safer at home order so that Nashvillians and Davidson Countyans are doing their part to reduce the spread of this disease. But I'm worried because we're such a healthcare capital here in Nashville. People from all over the state and all over the region, multi-states, are going to come to Nashville to our hospitals because they're going to be sick as can be, and they're going to want top quality medical care, and that's what we've got in Nashville. But that also means that unless we have statewide or region-wide safer at home orders, we're just unduly going to be filling up our own hospitals.
So you think that's what Governor Lee ought to do? He ought to put a shutdown order for the entire state of Tennessee?
Well, I think it's better to be safe than sorry. And wouldn't you rather have reduced the death toll in Tennessee than to have risked countless people passing away? Because right now we don't know the simple question of whether this is like the flu, which already kills 40,000 people a year, or so by some measures it could be 10 times worse than the flu. We simply don't know. Hopefully it's not nearly that bad. But until we know, you're just gambling with human lives if you don't take maximum precautions.
And Congressman, I think perhaps the biggest problem is all this personal protection equipment that nobody can seem to find, whether it's ventilators or whether it's masks. I mean, the state of Tennessee even told doctors this week that they need to start using diapers. They need to start using swim goggles to protect themselves because we can't seem to find the masks. We haven't been able to find the ventilators. And now all 50 states are out competing with each other to get these ventilators, along with cities and hospitals, and the federal government's competing for them too. If this is a war, we're certainly not centralizing the effort.
Well, Pat, you're exactly right. One day the private sector will gear up and supply all the equipment we need and more, but we have to buy time until that day comes. And in the meantime, a lot of the equipment is inequitably distributed. There are some wealthy counties in Tennessee that have plenty of it and that are offering it for sale at very high prices. There's some other counties that are poor and have very little. But what matters is that the medical professionals, doctors, nurses, and other health professionals get the equipment they need. I was proud of the governor for declaring that dentists and outpatient surgery centers should stop their elective operations so that that PPE could be supplied to the medical professionals who, sadly, very soon are really going to need it in Tennessee. We need the goggles, we need the masks, we need the Tyvek suits, things like that, so that our medical professionals can be safe, because if they get sick, as is already happening in Boston and places like that, then who's going to take care of us? This is as serious as can be, and we need to be taking the appropriate steps.
Congressman Jim Cooper is our guest on Inside Politics. Back to continue our conversation with him on the other side of this break.